Welcome back, everybody, to Adolf and Kalkstein Chiropractic. Today we got Anna and Jonathan in the office, and we're going to show you a little bit of the active care component to people that are suffering with upper back and neck. All right, welcome back, everybody. So we've shown you some of the passive care that we do with Anna, aka the adjustments or the manipulations to her upper back and neck. We showed you how we did some active release techniques, some soft tissue work on her upper back and neck, and dry needle work. Now we're going to show you what Jonathan specializes in here at the office. So a lot of our patients, they come in with a lot of pain. We're really good at getting people out of pain, and then we transition them into more of an active set of exercise or active care. So that can involve stretching, mobility work, endurance, strength, and power. So Anna's at a point where she's out of pain, right? She's moving really well, and we're going to show you what someone will experience typically going through an exercise program in the office. So Jonathan's going to take over, and he's going to show off all his knowledge when it comes to treating people with upper back and neck pain. You ready, brother?
Always.
Anna. It's Anna's last day.
Anna's last day.
Yeah. So it's our gift for her is to do bear crawls. So I'll be behind the camera just kind of making comments as we go through, and Jonathan's going to take it away.
All right, Anna, so we're going to get started with some soft tissue work, some foam rolling. So you grab a foam roller up here. We're going to start with your mid-back and then do some of your lats, serratus muscles. So we're going to sit down on the ground. The roller is going to start about draw line when she lays back on top of it. She's going to interlock those hands behind the head so the neck can relax into the hands. She's going to lift her hips up through her heels and propel herself pretty much to the base of her neck where she is now back to that starting point. And we're ideally going to do about 20 to 30 seconds per muscle group, but you know, she's pretty warmed up, so we'll probably just do a few rolls just to demonstrate the movement itself. And if you can see what Anna's doing, if she brings in her elbows a little bit closer, that's going to help open up those lumbar a little bit more. So depending on where there's tightness in the muscles are, you can kind of play with either extending the elbows or bringing a little bit closer in. So now we're going to do a little bit more of the lats and serratus muscles, Anna. So we're going to lay on your side. Let's have that left leg, right leg straight out, left leg across. Perfect. And any of you who have not done this before, first time, and you might cry.
Apparently Anna smiles when she's in it.
So we're going to try to keep that arm that's extended nice and straight, ideally palm to the floor, and really working all those lats and serratus muscles.
You're doing a good job smiling.
Let's do the other side just for a few rolls, and then we'll get into the bear crawls.
That was a little bear grunt? What was that?
Right?
So you can see those tissues moving over the foam roller. That muscle, that latissimus dorsi muscle that comes all the way from her back and it goes up to her arm there, attaches. And so people can be a little bit tender and tight there and restricted in arm flexion. So we want to loosen up that lat muscle so they have good mobility on all these shoulder exercises that we're going to do. So we start the exercises off with mobility or soft tissue work. So you just finished that component. We usually do it for a little bit longer, maybe 2 minutes on each area, right?
Yep. So now we're going to get into more dynamic warm-up with that. So we're going to do some bear crawls now. So we're going to just move this out of the way. So Anna, if you want to get into a quadruped stance with me. And we're doing a 4-point contact with the bear crawl, meaning toes and hands are the only contact with the floor. And so Anna, once you move your knee in with the opposite hand, moving simultaneously together. Perfect. Small steps are the key here, keeping everything nice and neutral from the neck all the way to the hips, not tilting any deviation from that neutral spine. Do a couple more crawls going forward. So notice how Anna's doing a really good job of keeping a flat back. It's almost like I could balance an apple in the middle of her back and it wouldn't roll anywhere. Good. Right? So keeping the core nice and tight, she goes through this exercise. As you can see, she's already starting to shake just a little bit. It's really intense if you do it correctly. So if you do it slow like this, with controlled movement, keeping the core tight while you go, this will be an awesome overall warm-up for your core, shoulders, and legs for any kind of workout, okay? It's called bear crawls. So that was going front, so now we're gonna go lateral or sideways. So same concept, she's just moving now laterally.
So what arm and leg is she moving at the same time?
So she should be doing cross-sectional, so moving with her left arm with her right foot, her right arm with her left foot. Not coming too far away from that midline, so as long as her hips are really in line with the knee the whole way through. That's really good, Anna.
Keep focusing on your breath, Anna. Nice and controlled. So we emphasize diaphragmatic breathing with any of these exercises, keeping the core tight and in control. Go back the other way, Anna. She gave the look up like, can I stop? Good job, keep it up. So we want to get almost a little bit of a sweat at this point. These exercises are difficult enough if you do them correctly, where you'll really feel the burn in not only the quads, trying to stabilize her hips and her psoas, but also her arms and shoulders and core. So it's a good full body warm up.
Good, Anna.
And you can make bear noises while you do it, Anna.
Absolutely. That is highly encouraged. So now we're going to get into some mobility work. So she's pretty warmed up after doing those crawls.
Sebastian with the shout out. Hey, Sebastian.
And first one that we're going to do is...
What's up, guys?
We're doing a quadruped T-spine rotation, so almost in that same position with the tabletop, but we're going to bring one forearm down like it is, in line with that knee. We're sitting the butt back as low as we can to the heels, locking this lumbar out, because our main focus is going to be up in here in that mid-back T-spine. She's a little bit advanced, so we're going to have that hand behind the head. She's going to inhale coming down together, touching the elbow if she can, and then exhaling with that rotation, focusing on really getting that torque tension through here, not in this upper trap. So bring this shoulder blade a little bit down, Anna. Rotate that neck a little bit more if we can. Nice. And then we're just going to repeat that a few times. So the breathing wise, inhaling on the way in, loading that movement, exhaling with that extension.
So Jonathan does a really good job coaching through the breathing work, right? If Anna were just to kind of jump into this and just go boom, 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 she wouldn't nearly get as far if she didn't focus on exhaling and relaxing into the stretch and really mobilizing her thoracic spine.
Nice.
To refresh on what Jonathan said, she's sitting back on her heels because it allows us to lock this area of the spine out, as in not move it as much. It's going to move a little bit, but really it focuses a lot of motion in this area. And Anna can tell you, if you try it at home, you'll definitely feel the difference if you rock back onto the heels as opposed to being in quadruped or up on the hands and knees. Hey, Anna. All right, Anna, let's see if you can say hi to the camera from this angle. Come on, get there. There, you made it. Keep it up. So we're just going to give you a different angle just to show you. She's pulling that elbow to the ceiling. She's trying to look where she goes. The body will follow where the eyes move towards. And she's just trying to improve that range of motion. So we did the mobility work with the foam roller. She got a little bit of her heart rate up and her core engaged with the bear crawls. And then we go into more stretching and active mobility work, right?
Good. So we're pretty much going to stay in the same position for the next one, guys, and do the reach roll lift. It's going to really help strengthen the posterior scap muscles back in here to really focus on having tension through that muscle here and not through that trap. So Anna, make a fist with that left hand, forehead on the fist. So she's starting with that elbow next to her knee. She's going to reach out with that hand. She's going to roll or supinate as much as she can, and then she's lifting that arm. So primarily, like I said, we're really focusing on this area through here, and relax and just repeat that whole movement for us. So she's reaching out. We want to calm this muscle down, almost retract that first before we do that lift. And then just do one more on this side and then do the other side. So if we see a lot of patients kind of muscling through that to get up there, we can kind of guide their hand and assist them up. So retract and then help them get a little bit more into that stretch. Good. See the other side?
So Jonathan, go ahead and hold the camera for just a second.
Absolutely.
I want to show them something with this, okay?
Go ahead and reach.
So what Jonathan is saying is that sometimes people will be really dominant. Like Anna's just a little bit dominant in her upper trap and neck area when she tries to lift. So I want to guide her and get her to utilize some of her lower back, lower scap muscles to better lift her arm up. So not be so strong here, because if she tries to dominate from this muscle here, she won't get as high. So make sure if you're doing it at home and you're like, I cannot lift my arm up, try to get someone to relax you up by your shoulders, up by your neck, and get the motion to come from here. And a little guidance from my hand allows her to feel those muscles working a little bit better, and then she can get it on her own. Go ahead. Lift, good. Here. Good job, and relax back down. Like with any of this stuff, right? If you're getting frustrated at home, if you tried some of this mobility work and you don't feel like you're getting a lot out of it, just be patient, all right? That motion will come. Anna's been working on this for a little while, and she's really improved dramatically, but it's taken a little bit of work, right? It's taken about 4 or 5 weeks for her to get better range of motion there. So it's not just what your PT or your chiropractor or your ortho is doing with you in the office. It's a lot of the work that you have to do outside. It's a teamwork. Teamwork make the dream work.
Teamwork make the dream work.
All right, dream team. Let's keep going here.
All right, so now she's all primed for the strengthening part of the program, aren't you, Anna?
Oh yeah.
Feel loose and goosey.
Goosey.
Hey, yes. So we're gonna start with some single arm or unilateral.
Look how excited you are to do straight.
So we're gonna let's use this one so we get the cool background with the squat rack. So Anna, if you want to grab a 15-pound dumbbell.
So a lot of our strength exercises we superset, and we don't really want to stick too much to doing too much in the in one direction. So she's gonna push, and then she's gonna do a pull and a press. So you'll see how we change up the directions she's using, and it changes the muscles that she's using in the shoulder as well.
So we're gonna bring this arm straight up in full extension first in that starting position up top. We're first gonna kind of retract that shoulder blade down. So we prime that with those first 2 mobility exercises. When she lowers down from the elbow, a little bit slower, inhaling through that diaphragm, exhaling when she's pressing through. On the way down, Anna, I want you to feel like this part of your core is really catching that dumbbell. Same concept, making sure that she's nice and squishy through these traps, not really compensating or over using those traps to get that press. Breathing, feet nice and secure on the ground. She's not tilting or leaning away from that load, so that's where the core really comes in play. Nice, let's do 2 more on that side and then switch.
So what Jonathan's saying is that you can see her head's not going out to the right when she lowers the weight. Her core and her back are staying nice and strong, and the only joint that is moving is her shoulder joint and her elbow joint. Everything else is being very still, right? So that if you do it that way, you can get a really good, you can get almost a burn or some, you can feel it in your core very well. She's breathing in again as she lowers the weight. She exhales the weight up. Blow out that candle.
She's not hyperextending through her back, so a lot of people when they press, they kind of almost arch or make a gap between the bench and her back. She's nice and flush against that. Core is always engaged. If she was a lot trap dominant, we would just place a little pillow behind her head to kind of take that neck joint stability out of that and really focus on just the press and the movement itself. Perfect.
Perfect demonstration, Anna.
Oh yeah, so now we're gonna superset that with the eccentric pull-up lowering. So,
Oh gosh.
do you wanna jump up? Do you wanna step?
I can jump up.
She's gonna jump up. Good. She's gonna pull
look at that
herself
pull.
up. Jonathan sets her up in that top position. She's gonna lower down with a 4 count, extending the elbows all the way down to the bottom. Okay, go ahead and step off for us. Let's get a step up for her.
Yep.
She doesn't want to get burned out. Are you excited to go back to College Park?
Very.
Yeah, why are you excited?
It's my last year.
It's your last year. That's exciting. And she's getting to get ready to go to either PT or what else do you think?
PA. I think I'm
school.
doing PA now.
Oh, okay.
Back
So
and forth.
back and forth. They're very similar fields. PA is going to be a little bit more whole body health, and she'd be able to do a lot more in terms of prescriptions and treat a whole range of conditions. So that excites you, doesn't it?
Yeah.
Yeah. Good for you, Anna.
Yes.
So she steps up onto this area here. She presses herself up into the starting position and she lowers down on a 4 count. 3, 2, 1. Jonathan's doing a nice job of telling her to squeeze her core. You don't want to see too much swing when you have this position. So jump yourself up, Anna. Good. You hold. 4, 3, 2, 1. Good job. Step yourself up. Let's do 2 more good ones here. So jump up into that starting position. Go ahead, Jonathan.
Try to relax the muscle right here. Pull in when you lower. Keep breathing. Getting really tired. We've got 1 more in you. Relax, relax. Pull apart. Almost
Nice job.
Separation. There you go. Excellent. Hard.
Very.
Successful though. That's what we want to do with these programs, is challenge you guys, but also be successful at the same time. So we're going to do a core work with the press. So we're going to come over here. And what's this one called, Anna?
Pavlov press.
Oh yeah. So you're going to start with the back leg, or the inside leg is going to be on the back. Bring the other leg in the front, so we call this half kneeling. We're going to grab the band. So first motion, Anna, I want you to grab both hands, pull into the chest first. Inhale through your stomach, exhale when we press out. Keeping your traps nice and relaxed. Focus on that core engagement, lock out those elbows. Now inhale on the way in again. Relax up here, better, and then press through that core, keeping everything in line with the hips, with the knee, not extending through the back here when she presses. Let's do 3 more good ones just like that. Calm these down. Good breathing. So the whole point of this is that the band is going to pull you this way, so she's fighting against that to keep nice and strong in her core and keeping her pelvis and core nice and neutral and still.
So she's in that 90-90 setup. Her pelvis is nice and flat as much as possible. So she's not arching in her low back. She's not extending her low back to be stable. She should feel that pressure, that burn all the way through her entire core, especially in the front and on the left side, trying to hold herself up. Oh, see, you can see her trying to fight to keep tall, and she's doing a great job of it. And back in.
Okay.
Good work.
Let's do a few on the other side to even things out. Good.
Good job. So what's great about these exercises is that Anna, if she was a patient coming in, she would have started with some warm-ups, done the exercises, gotten finished with this, had some type of therapy to help loosen those muscles even more, like the ice and stim or the dry needling, and then she gets adjusted. So she gets rehabilitation exercises, she gets pain management with some of the soft tissue work, and then she gets adjustments to improve the mobility and decrease pain in the joints. So she really gets well-rounded treatment here in the office, and she could, if she was a patient, she could walk in any day to get that kind of setup. So it's pretty unique environment here, and you've got someone like Jonathan who's really really knowledgeable when it comes to all these exercises that we're doing, and is able to walk through people one-on-one and really take them through it in
Sweating.
an amazing way.
Good.
How you doing, Anna?
Sweaty.
Sweaty?
Yeah.
Oh yeah, well we got one more for you guys. It's gonna be the single arm dumbbell row. So Anna, why don't you grab a 20-pound dumbbell. And we're gonna be in this position here.
This way.
So setup wise, we want a nice neutral spine again, as always. We want to scoot this body a little bit forward, so primarily that shoulder's in line with that wrist. She's gonna have a slight bend in the knees, and then when she's gonna row this dumbbell, she's gonna aim right to the next of her belly button, her hip, when she pulls that dumbbell up. Squeezing through here, go ahead. Holding for a second, lowering down, nice and slowly. So before she even pulls that up, I want you to retract the shoulder blade first. Pull, perfect. Pull up, hold for a second, and then slowly back down. So she's gonna breathe now, inhaling first, exhaling when she raises up, and then inhale again on the way down. So you can see a lot of this engagement with that muscle right in here. She's not trap dominant, so do a bad one for us, Anna, where you shrug. Yeah, see how high the trap engagement is? All that integrity through here we're losing, so she's doing a really good job of focusing on the proper muscles that are engaged. She's not hunching or rounding up the back. Nice and strong in the core. And now let's see the other side.
Anna, you're perfect.
I know.
Set the shoulder, do the pull, focus on your breathing, inhale on the way down. Set the shoulder, 2, 1, 2, 3, 2, 1.
Perfect.
So sometimes we'll do a little count, 2 second on the way up, pause, 3, 2, 1. Good. 2 more on this side. Pause, 3, 2, 1. Last 1, 2, 1, 3, 2, 1. Good job. Okay,
Nice.
you can go ahead and rack the weight.
And that is it, guys. Killed that.
Have you?
How do you feel?
Great. Sweaty again.
Like 25, 30-minute workout. It's efficient. Got it done. Now you got the rest of your day. And thanks for joining with us. We'll see you guys next time.
Nice jersey, Jonathan.
Thanks, man.
Rocking the Jonesy.
Oh, yeah.
Shout out to Adam.
Yes.
Biggest fan. All right, thanks so much for watching, everybody. We appreciate it. And if you're someone in the area that's suffering with upper back, neck, or shoulder pain, you got an awesome team here. -1. We'll miss you. But Jonathan will be taking up the slack, and we look forward to helping you out with whatever issue you have going on, with whatever musculoskeletal pain you have going on. Thanks for watching. Have a good one. Cool.
Sweet.